This free webinar series, hosted by the NHTSA Office of Emergency Medical Services, will provide the EMS community with a unique opportunity for federal EMS agencies to share information with the EMS community in a manner that is more personal and less time-consuming than attending conferences, yet offers the community the opportunity to interact and ask questions that a newsletter or article just doesn't allow. Our plan is to conduct webinars every other month on issues that are important to the EMS community and to provide you with timely information on what federal agencies are doing about them. Today's webinar is being recorded and will be archived on ems.gov for future viewing and listening. More information on the EMS Focus webinar series can be found on ems.gov, where we will also archive these presentations. During this, our first webinar, we'll take a look at how federal agencies have invested a lot of time and energy into creating a strategic plan that lays out in some detail how they will work together on a number of EMS issues during the coming years. We know that the federal EMS efforts in EMS haven't always been easy to understand to the EMS community. We hope that this webinar series and on a larger scale, the coordinated work of FICMs will help shed light on the good work of some really good people and agencies. There is a perception that federal agencies are not working together or not focusing their efforts in the right areas. I think as we delve into this topic, it will become more clear which agencies are involved in supporting EMS at the federal level, why those agencies and departments are involved, and the programs that are providing tools and resources to support the EMS community as it continues to grow and focus more on the gathering and use of data and information, evidence-based care, and the safety of patients and providers, and the development of a strong, well-educated workforce. And it will also become clear how it is that we're all working together as federal agencies to achieve those goals. But before we do that, I thought I would take just a few minutes and talk about what FICMs is. FICMs, or the Federal Interagency Committee on Emergency Medical Services, was created in 2005 by Congress to accomplish several specific things. It was envisioned to ensure coordination among federal agencies involved with state, local, tribal, or regional EMS and 911 systems, to identify state, local, tribal, and regional EMS and 911 needs, to recommend new or expanded programs, including grant programs for improving EMS and EMS communication technologies, and to identify ways to streamline the process through which federal agencies support emergency medical services. FICMs is unique, as it is one of the few interagency committees in the federal government whose mission and goal is so broad: to coordinate. By law, the membership of FICMs is comprised of representatives of 10 federal agencies from 5 executive departments that you see in this slide. And most of the members of FICMs are at the assistant secretary or the administrator level. These are folks who are high-level policy makers. FICMs meets twice a year, generally in June and December. The chair of FICOMS rotates among the three departments on an annual basis: Department of Transportation, Department of Homeland Security, and Department of Health and Human Services. The work of FICOMS is supported by federal staff who belong to the Technical Working Group. These staff meet at least monthly to conduct the business of FICOMS. It is now my pleasure to introduce the current chair of FICOMS, Dr. Kathy Brinsfield, an emergency physician who is the acting Assistant Secretary of Health Affairs and Chief Medical Officer of the Department of Homeland Security. Dr. Brinsfield.
Thank you, Drew. It is a pleasure to be here today and to use this webinar series to visit with EMS personnel throughout the country. Since FICOMS was created in 2005, it has worked on a number of important issues, including a national EMS assessment, pandemic flu preparation, and more recently, model uniform core criteria for mass casualty incident triage. It has also worked with a number of federal agencies, including the NTSB. Several years ago, FICOMS decided it was time to put down on paper a plan that clearly maps out specific action steps for federal support of emergency medical services systems nationwide that is a bit more long-term. Through a joint process that was funded by three departments, we worked together to develop a strategic plan that establishes priorities and timelines for our collaborative work for the next 5 years. The plan incorporates significant public input from several public listening sessions, as well as formal recommendations from the National EMS Advisory Council, or NEMSAC. The strategic plan, which was approved by FICOMS in December, provides a framework to synchronize federal interagency efforts and to help strengthen EMS practices, principles, and strategies throughout the United States. If you're interested in reviewing the FICOMS strategic plan, it can be found on ems.gov. The FICOMS strategic plan contains a vision and a mission statement, which provide an anchor for the strategic goals and objectives in the plan. The mission and vision statements clarify the role of FICOMS and our intention to support the needs and efforts of the EMS professionals across the nation who deliver care to their communities daily. The plan also includes 6 overarching goals and 30 specific objectives. Just to clarify, it's important to mention how FICOMS does its business. First, FICOMS does not have a new pot of money to fund projects and priorities. However, we do have the capability of better focusing the new and existing activities each of our agencies does upon some common priorities. We help to make sure we are all pulling in the direction, and we help to determine what that direction is. We help avoid duplication among agencies, and it may help us in formulating our budget requests. FICOMS plans to achieve these by coordinating interagency policies, programming, and messaging, as well as soliciting and integrating stakeholder input from across the EMS community, including from the National EMS Advisory Council. In fact, as the chair of FICOMS, I sent a letter to the NEMSAC chair, Mr. Aaron Reinhardt, asking for NEMSAC advice on how to best implement and update that plan over the next several years. We asked NEMSAC specific questions that will help to better inform FICOMS in prioritizing the objectives, in measuring our success, and in implementing them. NEMSAC will also be deliberating their recommendations to us in a public forum. My letter to NEMSAC can be found on ems.gov. We look forward to hearing their advice at our September FICOMS meeting. At the December 2013 meeting, FICOMS members approved the strategic plan and also identified 4 focal areas for immediate action. These 4 focal areas were chosen because they were areas FICOMS felt were high priority and were of immediate importance, and also had some ongoing activities so we could demonstrate its success and help test the process. I should emphasize that we are all learning about this together. None of us has a corner on the knowledge it takes to develop and to implement a strategic plan of this magnitude. All input and suggestions are welcome. The 4 focal areas chosen pertain to data, evidence-based guidelines, preparedness, and military to civilian credentialing. Our FICOMS Technical Working Group has created a committee to address each objective. The committee chair will provide a short summary of their progress and a bit of information about their future plans. Keep in mind that the committees have just recently begun their work on this specific plan. The 4 committees are co-chaired by staff from several different departments and are listed on. each of the, including an amazing array of talented people from many different federal agencies. Each committee will now give a short summary of their tasks. While their work plans and status reports will be presented to FICOMs at our June meeting, they will speak briefly about the tasks they've agreed to undertake. Susan McHenry from the NHTSA Office of EMS is co-chair of the Data Committee and will be our first presenter.
Thank you, Kathy, and good afternoon, everyone. First, I'd like to just review the objective that you see there. This is the first of the priority objectives, is promoting standardization and quality improvement of pre-hospital data by supporting the adoption and implementation of the National EMS Information System, or NEMSIS, compliant systems. My committee is also co-chaired by Kevin Horahan from the Department of Health and Human Services. The standardization of EMS patient care information is important to document the special contribution that EMS makes towards improved outcomes of the patient. It will help you evaluate your own system and make system improvements, and will allow comparisons with your neighboring services and your state, as well as nationally. FICOMS, the Federal Interagency Committee on EMS, has long held NEMSIS as one of its very high priorities. This objective addresses both the need for continued standardization of EMS patient care data, but also the importance of very accurate documentation that can inform the next level of care. FICOMS hopes to support continued enhancement of NEMSIS in a way that will provide the best information to improve your agency and the care of your patients, to share with other healthcare providers caring for the patient, and to support EMS research. The Technical Working Group Data Committee is represented by most of the FICOMS agencies and is collectively working on this and one other objective related to health information exchange, which I'll mention later. We all believe this data will also be useful to our individual agencies. NHTSA has been the primary federal sponsor for the development and implementation of the National EMS Information System since about the year 2001. The current status of NEMSIS on a national level includes data from 46 states and territories that submit their local EMS agency data into the National EMS database. Over half of these states are submitting greater than 90% of their total patient records from their states. There are others that are close to 90%. There are approximately 43 million records in the national database. The Health and Human Services Assistant Secretary for Preparedness and Response has been the primary sponsor for recent efforts to integrate our EMS data with health information exchange, highlighted by a major national meeting on this opportunity that was held in February of this year. Several of you folks from the EMS community participated in that meeting. Work is also underway to achieve a bidirectional sharing of patient care data, where EMS could receive critical information about their patient, such as medical history, medications, and allergies, while they are actually caring for the patient in the field. The Data Committee will continue to report to FICOMS on progress in transitioning to the new version 3 of NEMSIS, which will better enable the health information exchange. And our federal agencies will continue to work on tools that will help you more effectively use your own data.
Thank you to Susan and the Data Committee. Dr. Elizabeth Edgerton with the Department of Health and Human Services, EMS for Children, is co-chair of the Evidence-Based Guidelines Committee and will be the next presenter.
Thank you, Dr. Brinsville. I'd like to also thank my co-chair, Dr. Kathy Gottschall from the Department of Transportation. The Evidence-Based Guideline Committee is charged with coordinating federal efforts to support the implementation of Objective 2.1 of FICOM's strategic plan, specifically to support the development, implementation, and evaluation of evidence-based guidelines according to the National Pre-Hospital Evidence-Based Guideline Model process. Let me first clarify for you the evidence-based guidelines. In the EMS context, evidence-based guidelines, or EBGs, are systematically developed statements developed to assist EMS systems, medical directors, and field personnel to make decisions about appropriate health care for patients in specific clinical situations. They're important because they provide the EMS system with a tool to help to improve patient care by synthesizing the findings of many scientific peer-reviewed papers into a few concise recommendations that can be incorporated to EMS protocols. For field providers, this means that they can be confident that the care they provide to their patients is based on the best available medical evidence. Statewide adoption of evidence-based guidelines means that everyone gets the same high standard of care. The evidence-based implies that the recommendations were created not only using the best scientific evidence available, but also processes used to develop the recommendations was transparent, unbiased, and systematic. So to summarize, evidence-based guidelines are a series of recommendations, and not rules, about patient care for specific clinical conditions that are supported by the best available evidence in the scientific literature. The National Pre-Hospital EBG Model Process was developed with input from the National EMS Stakeholders Organization and is endorsed both by FICM and NEMSAC. It is an 8-step process designed to bring a systematic approach to the development, implementation, and evaluation of evidence-based guidelines, and it can be found in its full form on www.ems.gov. I chair the committee along with Dr. Kathy Gottschall, Senior Health Scientist at NHTSA Office of EMS. We have a very impressive committee, many who are on the call today, so we thank them. But the main thing I want to highlight is the diversity of the membership on our committee so that we really capture the input and expertise of many of our federal agencies. We have Dr. Jeremy Brown, who's the Director of the Office of Emergency Care Research at the National Institute of Health, Dr. Brendan Carr from the Emergency Care Coordinating Center under the Assistant Secretary for Preparedness and Response, Dr. Stephanie is the Director of the Evidence-Based Practice Center Program at the Agency for Healthcare Research and Quality, Dr. Bill Rogers from the Physicians Regulatory Issues Team at the Center for Medicare and Medicaid Services, Dr. Mary George from the Division of Heart Disease, Stroke Prevention and the National Center for Chronic Disease Prevention and Health Promotion at the Centers for Disease Control and Prevention, Mr. Anthony Oliver from the Office of Rural Health Policy, Dr. Julie Sandovich from Indian Health Services, and from the Department of Homeland Security, Office of Health Affairs, we have Mr. Bill Cipher, and from the Department of Defense, we have Dr. Frank Butler, who's the Chair of the Committee on Tactical Combat Casualty Care, and Dr. Kamal Qasi. And again, the point of going to our members is just to really have you understand the diversity and the expertise we bring to this committee. Next slide, please. Recent accomplishments in the field of evidence-based guidelines have been supported by FICM's member agencies consistent with the model process include some of the following efforts. On this slide, you'll notice the cover of the pre-hospital emergency care. With joint funding from Emergency Medical Services for Children and NHTSA, we supported the development of the Eveline and publication and dissemination in the January 2014 special supplement to this journal. Again, this is a historic event in really putting out first publications on evidence-based protocols. Publication includes evidence-based guidelines using the National Pre-Hospital EBG Model Process, and topics that were addressed by the EBGs were pain management for trauma, control of pediatric seizures, helicopter transport of injured patients, and a comprehensive review of the process that's entailed in developing these protocols. Next slide, please. In partnership with the American College of Surgeons to develop an evidence-based guideline for external hemorrhage control, including the use of tourniquets and hemostatic dressings in the pre-hospital setting, another evidence-based guideline was published in 2014 April edition of Pre-Hospital Emergency Care, again into the knowledge base that's out there for field providers. Through funding through NHTSA and the Emergency Medical Services for Children, a meeting of EMS stakeholders was convened in January 2014 by the National Association of EMS Physicians to solicit input in the development of a national evidence-based guideline implementation strategy. As you see, we've developed a model process, we've developed actual EBG guidelines, we have a strategic planning group to ensure that sustainability over time. And finally, I'd like to highlight our other federal agency, where I'm housed for the Emergency Medical Services for Children, has funded grants over the next 3 years to focus on using the National Pre-Hospital Evidence-Based Guideline Model Process to develop 4 pediatric protocols on airway management, shock, allergic reactions, and final care, and then actually implement them system-wide in 6 northeastern states. Again, as you can see, the activity has focused on the methodology, the evaluation of the science, the development of guidelines, and implementation in the field, and finally developing a strategy for sustainability. Thank you.
Thank you, Dr. Edgerton. Gamwe Jatunga of the NHTSA's Office of EMS serves as co-chair of the Preparedness Committee and will present an overview of the work in completing their objectives.
Thank you, Dr. Brinsfield. Planning for EMS response to major incidents, large and small, impacts all of us very directly, whether at the local, state, or federal level. Ensuring funding coordination among the federal partners in EMS preparedness planning helps promote a smoother, more integrated response during the actual incident. And these efforts should help to identify opportunities for improved integration of EMS in preparedness planning. The Preparedness Committee has a diverse group of federal representatives, including, for instance, the Department of Homeland Security's Office of Health Affairs, the Federal Emergency Management Agency's U.S. Fire Administration, the Assistant Secretary for Preparedness and Response at the Department of Health and Human Services, the Centers for Disease Control and Prevention, the Department of Defense, and others. One of the committee's strengths has been the ability to enhance the dialogue among agency staff on nearly a daily basis and to collaborate among the programs. This collaboration, in turn, avoids federal duplication and provides a more consistent message to our state and local partners. Effective response to disasters is dependent upon a well-coordinated response at the state and local level. As described in the National Health Security Strategy, an EMS system is essential to the nation's preparation for the initial emergency medical response to catastrophic incidents. By collaborating on a day-to-day basis, the members of the Preparedness Committee seek to improve federal support for EMS preparedness efforts at the state and local level. An example of how this is done is by coordinating FICOM's input into federal grant guidance, such as the Homeland Security Grant Program, or capability guidance, such as the Center for Disease Control and Prevention Public Health Preparedness capabilities, and the Assistant Secretary for Preparedness and Response's Healthcare Preparedness capabilities. While there are a number of other activities that will be proposed at the June meeting of FICOMS, one of the major FICOMS activities we have undertaken is the development of the document you see on the screen, National Implementation of the Model Uniform Core Criteria for Mass Casualty Incident Triage, a report of the FICOMS, on July 8th of 2013, and also known as the MUF report. Adoption of the several recommendations in the report will help to ensure more uniform implementation of mass casualty triage throughout the nation and encourage federal support of triage systems that are compliant with the uniform criteria. I would encourage you to review this report, which is available on www.ems.gov. The Preparedness Committee monitors and oversees implementation of the MUF report. An example of ongoing work under the MUF report is collaborative work between NHTSA and the National Center for Disaster Medicine and Public Health, or NCDMPH. To provide better education to EMS personnel and others on the principles of MUF, the National EMS Advisory Council recommended Action Step 1.1 in the MUF report, which was to create an addendum to the instructional guidelines of the National EMS Education Standards that outlines the MUF principles. The National Center for Disaster Medicine and Public Health is collaborating with NHTSA to develop this addendum. The National Center is located at the Uniformed Services University of the Health Sciences in Bethesda, Maryland. We expect a draft of this addendum to be completed later this year.
Thank you to Gamwe's committee. And now back to Drew Dawson with the DOT's Office of EMS to discuss the final focal area, veteran to civilian credentialing.
military medics and hospital corpsmen have extensive experience with administering care in high-pressure situations, experience that can serve them well in EMS jobs. And the Department of Labor estimates a growth rate in the employment of EMTs and paramedics. However, across the United States, the transition from practice in military to state EMS licensure, bridging to higher levels of EMS certification and subsequent employment could use a bit of improvement. To being an area of intense interest to FICOMs, the First Lady's Joining Forces initiative has drawn attention to the EMS military credentialing and licensing issues. Under the White House initiatives, a federal work group chaired by Marion Kane from the Department of Defense and myself has developed a work plan whose efforts are being seamlessly coordinated with that of FICOMs. The goals of the federal work group address improving the preparation of the personnel in the military and activities to expedite their civilian credentialing after leaving the military. Within the military, there is strong emphasis on providing opportunities for all trained and eligible military medics and corpsmen across all services to achieve certification or recertify as nationally registered EMTs prior to separation from the service. The involvement of FICOMs in this effort helps to bring the energy and resources from additional agencies to this important goal. Among our current and planned activities include, for instance, the federal work group under the auspices of the White House initiative briefed recently both FICOMs and the National EMS Advisory Council. In late June of this year, the federal and non-federal invitational stakeholders will hold a joint conference call to explore activities to date and to identify opportunities for collaboration moving forward. The National Association of State EMS Officials has released national guidelines for incorporating veterans into state EMS workforce planning and development efforts. We will assist state offices of emergency medical services to promote more uniform licensing requirements for separating service members, veterans, and their spouses. And we will identify and document best practices in academic bridge programs that transition military medics and hospital corpsmen to civilian EMS certifications. So this is an exciting time for both FICOMs and for the national EMS community. Many collaborative efforts are already underway, including standardization and quality improvement of data, as well as the White House's priority initiative to support the transition of military veterans into civilian positions, as well as a number of other activities that you've heard about. As we move forward with implementing the strategic plan, we look forward to working together and working with our national, state, and local EMS partners in moving EMS ahead. More information about the work of these committees and their future work plans will be shared at the next FICOMS meeting, which will be here in DC, June 19th. That meeting is open to the public, and more information is available at ems.gov. At this time, we'd like to open the floor for any questions or comments that you have. I believe that our partners at Red Flash will reiterate what the instructions are for asking questions. So, Greg, if you'll go ahead, please.
That's right. Thanks, Drew. Again, everyone, as a reminder, if you have a question, please click the raise hand button in the middle of the left column. Then go ahead and type your question into the chat box. We're going to answer questions in the order that they're received, and if your question is not answered today, we'll provide a follow-up, and we'll also provide an email address for additional questions at the end of the webinar. That being said, we have a few questions already. The first one surrounding NEMSIS. Question being, how is version 3 different? In terms of the bidirectional sharing of patient data, how would that actually work? Is there a time frame for this?
Thank you for the question. One of the major differences between the original version 2 of NEMSIS and the new version 3 is that it's a much more robust database that gives us much more information to be able to see how we're doing, particularly with time-critical conditions, stroke and STEMI and out-of-hospital cardiac arrest, as well as trauma. So that'll be very valuable to us, I think, in the field and seeing what a difference we're making. In addition to that, we have taken this new version through a special standard development organization that helps us to harmonize better with other healthcare databases and kind of speak the same language that they do. And that's going to really facilitate our efforts to coordinate with the Health Information Exchange and efforts to incorporate your electronic EMS patient care report in with the patient's electronic health record when you're transporting the patient to the hospital. It's up to the states in terms of how soon they can transition over to version 3, but there are many states that are already well along the process, and so I expect over the next year we'll see pretty significant transition to that new version, and we'll keep it. Fantastic. Thanks, Susan. We do have several questions coming in about where this webinar will be hosted or where the presentation will be available after. At this time, I'd like to go ahead and say that it will be up on ems.gov shortly. Now, moving forward with another question, we have a question. There has been a lot of news related to Middle East Respiratory Syndrome, or MERS, with the first cases reported in the U.S. last month. How is this being monitored?
So I think it's a great question. This is Kathy Brinsfield. I think it's a great question, and I think that that's important to defer to CDC. CDC has on their website information on MERS, and any questions that people have relative to what's happening with MERS, they should discuss with either their local public health department or look for the information on the CDC website.
Fantastic. Thank you. We have another question surrounding veteran credentialing. In terms of working with the state offices of EMS, is the goal to have a veteran credentialed in one state to be recognized to work in other states?
I think our goal is to make sure that as veterans come out of the military, that they are nationally registered first and foremost, and secondly, that they are eligible to apply for and receive certification seamlessly in most of the states within the nation, so that there is some seamless certification throughout the state, so that they are eligible to receive state EMS licensure and certification within each of the individual states.
Great. Thanks, Drew. Another question.
Greg, the other thing I would mention about that is that under the auspices of our good friends at the Department of Homeland Security, the Office of Health Affairs, that NASEMSO is also working on an interstate compact for licensing and certification of emergency medical services personnel that will in part help to address and expedite the issue of both military credentialed people and the interstate movement of personnel on a day-to-day basis. So.
Okay, great. Drew, and on that we have essentially a follow-up question. Is there a matrix created yet for military to civilian transition in a crosswalk format?
You know, we have done some matrices in draft forms as we begin addressing this issue. I'm not sure that there are any that are necessarily ready for a prime time right at the moment, but that certainly is one of the things that we are working on in conjunction with our folks both at the military and the National Association of State EMS Officials.
Great. Thanks, Drew. Another question here. You mentioned there is a new, quote, pot of money to fund projects. Compared to fire and law enforcement, there's a perception that EMS doesn't get the recognition on a national level. How can FICOMS change this and get more resources for EMS?
So, unfortunately, I think what I said is there is no new pot of money. And this is not something that necessarily I think FICOMS can change. It's our job in FICOMS to make sure that the money that we do have coming to EMS is spent in a collaborative fashion and spent wisely.
Great, thank you. I'd like to make another call. Is there any more questions out there? Again, if there is, please feel free to type them into the chat box and we'll do our best to answer.
Greg, this is Drew. I would also mention that what the strategic plan does is to call attention to the work and the efforts on the interagency basis, and will also help us to identify what needs and deficiencies there may be as we move forward, which I think will be helpful to all of our agencies as we identify budget items for presentation to the administration and to Congress, but it will certainly not guarantee any additional funding.
Fantastic. Thanks, Drew. We do have another question here. You mentioned, Drew, National Registry for Veterans, which I applaud. Is there any conversation towards having a national EMS license without the need to seek reciprocity in states?
No, there's not. Let me just re-emphasize that the Constitution of the United States actually affords the states the clear-cut responsibility for the control of safety, and that includes the licensure of healthcare professionals. So that's very clearly the responsibility of state government, and that's one of the issues that the NSEMSO Compact funded by DHS is addressing, is how to work to assure that the states work together in the best way possible to honor their individual state level responsibilities and constitutional authorities while still realizing the need to coordinate and cooperate with each other.
Great. Thanks for the clarification, Drew. A question, how often is the FICOMS strategic plan updated, and what can we do to be helpful?
The frequency, this is Drew, the frequency of updating of the FICOMS strategic plan is one of the questions that we have asked the National EMS Advisory Council to respond to. So we have asked a variety of different types of input to us, including the frequency, what are the priorities in the strategic plan, and several other questions. So the frequency, we have asked them to respond to that for us right now is a 5-year strategic plan. They will be having everything that we do and everything that they do is in public session. They will likely be having a public session to address the input to the FICOMS strategic plan. I would guess the first one of those will likely be at their September meeting, and they will have recommendations to FICOMS at the FICOMS December meeting. or at least they will take action at the NEMSAC December meeting to present to FICOMs. So what I would encourage you to do is two things. One is certainly under the auspices of the National EMS Advisory Council, as they reach out for input or suggestions to the FICOM strategic plan, is to provide input and recommendations and your thoughts to them as they help to recommend priorities to us. The National EMS Advisory Council is the formal advisory council of the non-feds to the Federal EMS Advisory Council, so I would encourage you to provide input to them in all the avenues that they will be asking for it. Number two is, I think, as you review the strategic plan and have any recommendations or comments on that, feel free to provide those. We'll provide an email address. Email address is up there at ficoms@dot.gov. Feel free to provide those comments, suggestions, or comments to us at any time at that address, and we'll make sure that those are reflected in the summary of comments that we present to FICOM. So whether that is in comments, whether that is in frequency of revision, whether that is in the priorities that we have established or should establish, feel free to make any comments or suggestions about that.
Thanks, Drew. Another question, what can FICOMs do to help encourage the military to follow National Registry guidelines in their trainings?
I think that, this is Drew again. I'd just like to read briefly from the joint plan that has been approved between DOD and it's been approved by our federal partners and submitted. And the DOD has strongly encouraged and is supporting the National Registry certification as a basis for EMS licensure for those people in the military who are involved with emergency medical services. So it is required at the 68 whiskey level. Hang on just a sec here. It's required at the 68 whiskey level in the Army. The Navy now allows all corpsmen to sit for the National Registry exam. And one of the goals of our plan with DOD is that all persons who provide emergency medical services in the military will sit for, be eligible, and are eligible to take the National Registry exam, will in fact become nationally registered and hopefully maintain that National Registry throughout the course of their time in the military, if that is helpful. So the reading directly from the plan, it says all military emergency medical services personnel should be afforded an opportunity to achieve the level of certification with the National Registry of EMTs that corresponds as closely as possible with the level of training and experience acquired in the course of their military service. So I think the DOD is working very, very hard toward making that happen within the military, and they are doing everything possible to actually expedite that. We'd be happy to answer further questions if we submit a question at the address listed, if you like.
Thanks, Drew. The following is a question for the Evidence-Based Guidelines Committee. Will existing studies be considered as an evidence-based sources?
Dr. Edgerton, are you still on the line with us?
Hi, this is Kathy Gottschall, co-chair of the Evidence-Based Guidelines Committee. Yes, in the development of evidence-based guidelines. The development committee does an exhaustive of the existing literature and praises the existing studies for their methodology, the findings, the likelihood of bias in the report, and they synthesize all of this information into a single appraisal of the evidence as a whole for each specific clinical question that's addressed.
Fantastic. Thank you. At this time, that concludes our Q&A portion of this, our first webinar in the series EMS Focus. I am now going to turn it back over to Mr. Drew Dawson to wrap things up.
Drew, first off, from Kathy Brinsfield, the chair of FICMS, I'd just like to thank you and your staff for putting this together. It's been a great opportunity, and we would, of course, support any future opportunities to get together and have these meetings.
Cool. Thanks, Dr. Brinsfield. So thanks to everyone for attending today. This concludes today's installment of EMS Focus. It's kind of our initial foray into the EMS webinar for FICMS. I'd like to thank all of our presenters and those of you who have tuned in for participating in today's webinar. For those of you who are interested, the next FICMS meeting will take place on June 19th in Washington, D.C. Details about registering for the FICMS meeting will be available on ems.gov. Today's webinar is being recorded and, as noted, will be archived on ems.gov for future viewing and listening. The next webinar will be held on August 7th this year. So for more information on future webinars and to subscribe to the EMS Focus webinar series, please visit ems.gov. The next NEMSAC meeting, the National EMS Advisory Council, will take place on September 9th and 10th, also in Washington, D.C. Details about registering for that meeting as well will be available on ems.gov. And public comment is always accepted prior to the NEMSAC meeting, including on the strategic plan. So please send any thoughts and comments or questions to the email addresses that you see listed there for both FICMS and for NEMSAC. And I believe that concludes our comments. Thank you again. Have a great week, and thanks for tuning into this webinar series. We very much appreciate it. Bye.
Thanks, Drew. And as he just said, this does conclude the inaugural webinar in the new series, EMS Focus, a collaborative federal webinar series. We look forward to seeing you at our next webinar, which will be held August 7th. Thanks again, and have a great day.